Welcome to Avazen Health EHR, your complete EHR and practice management solution. In this brief video, we will describe the layout of Avazen Health, as well as perform your first treatment. When you log in, you will automatically see this default screen. At the top, you will see your name and your organization. Below is the home screen. Initially, this will appear blank, but that will change as you treat patients. The top half lists your recently completed treatment encounters. In the bottom half of the screen, you have your in basket. If someone else, let's say a nurse, forwards a patient's treatment to you, then you will see it here. In the top right corner, you have your account controls to lock your application, sign out of Avazen Health, and to change your password. On the left side, you have the module controls to add and find existing patients, manage appointments, electronically process bills, and set up and user administration. Now, let's perform your first complete treatment. Before we treat a patient, we must either create the patient's record, or, if the patient already exists, we must first find the patient. Let's create a patient record. Click on the Add Patient button right here. In this screen, we can enter the relevant information to create the patient record. Fields with a red star are required. Let's enter the required information. We will skip the rest of the information for now. This can be updated later at any time. You can enter the insurance information by clicking on this tab here. We will skip this for now. Let's go back. We will now go ahead and actually create the patient record. Now, we can go ahead and click here to begin an encounter for this patient, but we will hold off on that for now. Let's demonstrate how to find this patient. We will begin the treatment that way. Click the Find button and search for the patient. Once you have found the right match, click on Begin Treatment to start an encounter for this patient. Let's start the encounter. When you begin, you will see this encounter treatment screen. In the top, you will see the patient's information, the vitals section, as well as features to define the location of the treatment and the treatment date. You can define the treatment date to be separate from the date the note is being entered. By default, you will see the patient notes area. You can then proceed to enter the treatment information by going along the left panel in sequence. Before we begin, let's enter the vitals first. Now, let's proceed from the beginning. Patient notes. The notes section is a rich text area where you can freely enter rich text notes in any style. Let's type in a simple soap note. Now, this can be a little tedious. So instead of typing entire notes each time, you can use custom defined templates by clicking here. Simply select your template and it will pre-populate below. Now you can enter your notes into your template. Using templates saves time while giving you the flexibility to document your preferred style. When you first start using Avazen Health EHR, you will not see any templates in here. You will need to create your own customized templates by going here in the setup. Creating your own templates is quick and easy and is described in detail in a separate video in our video library. Now, returning to our example, when you are done entering your notes, you can proceed to diagnosis and procedure coding. To enter diagnosis codes, click here. You can search for diagnosis codes by entering the diagnosis code, the description, or any related keyword. The system will find the best matches and show them in the section below. You can then select the relevant code by clicking on it. Your selected codes will show up in the section above. You can search for and add multiple codes. Let's add a few codes. I will type in a search term and select a few codes from the search results. To remove diagnosis codes, simply click on the red cross button over here. Let's add that back in. For procedure coding, click here. You can search for procedure codes by entering the actual procedure code, the description, or any related keyword, much like for diagnosis codes search. The system will find the best matches and show them in the section below. You can then select the relevant code. Next, you will need to review the units, associate the code with your diagnosis codes, and select a modifier. Your selected codes will show up in the section above. Of course, you can search for and add multiple procedure codes. Let's add a few procedure codes. I will type in, again, a search term, and I will select a procedure code. Next, I should review and, as necessary, update the units. Select a diagnosis pointer, and, as needed, update the CPT modifier. Once done, click OK to proceed. And the code, of course, will show up above. Let's add one more code. We will now go over the e-prescription process. Usage of the e-prescription module requires that a doctor have a valid NPI number updated in the user management section under Setup. This is explained in more detail in our video on user management in our video library. E-prescribing is a two-step process. First, you enter the drugs and dosage information, and then find the pharmacy of choice. For entering prescriptions, click here. You can search for drugs by name, ingredient, or any keyword you can think of. Let's type in an example. I can further narrow the search results. And to select the drug, I simply click on it. Let's add one more. Next, I can update the prescription information. Before proceeding to finding the pharmacy. To find the pharmacy, simply click here. You can search for pharmacy by name, location, or exact address. Let's type in an example. You can remove this pharmacy by simply clicking on this button. Let's add that back. This completes the e-prescription procedures. we selected the drugs here and updated the dosage information in the section above, followed by selection of the pharmacy of choice. After entering patient treatment information in the previous sections, you can now proceed to the signature page. On the signature page, you can review the treatment information before signing off and committing the treatment. To sign off on the treatment, you must first confirm your intention by clicking on the checkbox here. Next, you click on the Save button. When you do this, the patient record gets committed and the e-prescription gets sent electronically in the background. However, you may choose not to sign off on the treatment at this time and instead forward it to someone else in your organization. You can do that by clicking here. Here, in this drop box, you can select a recipient from your organization, and you can add comments. And an Act By field. When you submit this forwarding, this patient's treatment will be sent to the in basket of the other person in your organization. You select the in basket, that is the recipient, in this drop-down here. In this particular example, we will go ahead and save the patient record instead of forwarding to someone else. Confirm treatment and save. The patient's treatment has now been committed, and this screen may now be closed by clicking here. This wraps up our first complete treatment. As you can see here in the left side, there are additional functions for managing the patient's medical information. You can view as well as order and receive electronic lab orders. You can view and update a patient's problem list, allergies, and past and active medications. And of course, you can also update the patient's immunization records. You can also view previous records for the patient here. And finally, in the Documents section, you can view and upload documents for this patient, including images, x-rays, old lab results, and other documents. Each of these features is explained in more detail in short videos in our video library in the Help tab. Feel free to learn more by watching the corresponding videos. This concludes our video of getting started with Avazen Health EHR. We strongly recommend you to browse the video library in the Help section for brief and focused videos about many other features of Avazen Health EHR system.